it certainly is a wake-up call. It's a wake-up to all of the men in our country and certainly around the world.
Now at 4:30, doctors are urging men to get checkups. This after 82-year-old former President Joe Biden announced he had been diagnosed with prostate cancer.
About 300,000 American men are diagnosed with prostate cancer each year. NBC5's Patrick Fazio is joining us now after this big story that lots of people are talking about, Patrick, with what all men should be thinking about today.
Yeah, that's right, Alex and Marianne. Prostate cancer is actually the second leading cause of cancer death in American men, only behind lung cancer. Now, according to the American Cancer Society, prostate cancer kills more than 35,000 men each year here in the U.S. So today, we talked to 3 Chicago area doctors about some of the most common questions, like what are some of the symptoms of prostate cancer and when should you go to the doctor?
New onset urinary symptoms, new onset sexual dysfunction, unexplained weight loss, unexplained bone pain. It's worth saying that very, very frequently prostate cancer is diagnosed when it's not causing any symptoms.
Now, those symptoms usually don't show up until later stages of prostate cancer. So how can you catch it earlier? Well, doctors recommend blood tests to screen for prostate cancer, depending on your risk factors and how old you are.
Our national organizations do recommend we begin, at least we have the conversation of prostate cancer screening to patients between the ages of 45 to 50. Now, if you're in that age range and if you have certain risk factors such as Black ancestry, certain mutations, or you have a very strong family history of prostate cancer, well, then generally speaking, we like to offer screening a little bit earlier to begin at the age of 40.
And those blood test screenings are called PSAs, or prostate-specific antigen tests. The Mayo Clinic put out this graphic of what is considered a normal level depending on your age. Now, PSA levels tend to naturally increase as you get older.
One of the debates that has come up is to say, well, we use that test and we over-diagnosed a lot of men with kind of very, very low risk or very slow growing tumors that ultimately never would spread outside the prostate.
So if it's unclear if your blood test levels are cancer or not, a rectal exam can confirm if there is a tumor. Doctors can do a biopsy to give the tumor on that tumor, that is, to get a Gleason score to determine how severe is that tumor. Now, according to this chart from St. John's Cancer Institute, 6 or below is considered low, 8 or above is higher risk that it's an aggressive prostate cancer tumor.
I think what's most important that if a man is diagnosed with a aggressive tumor, a Gleason 8, 9, or 10 type tumor, a high-risk tumor, that all hope is certainly not lost. Even like President Biden, if it has spread to bone or other lymph nodes or other organs around, again, all hope isn't lost. It is still a very slow-growing relative tumor that still can be treated.
So here are some key takeaways to keep in mind. Talk to your doctor about your risk factors and get a PSA blood test depending on your age. Doctors say once you start doing blood tests, you should then get one every other year. And those blood test screenings are usually covered by insurance. But if you don't have insurance or if you need to get a free prostate cancer screening, Cook County Health is offering them for anyone, any man between 45 and 69 years old during their birthday months.
Well, that's
so
great.
something to keep in mind, yeah.
Okay.
Yeah.
And guys don't want to go to the doctor a lot, so it's good for the women to know this, to push the guys to go get.
The men, yeah, we don't always go to the doctor when we should. So this is why take this news as a checkup, a reason to go get a checkup.
Everybody needs to know.
Yeah,
thanks, Patrick.
Sure.
Thank you.